And New Zealand's government is set to scrap some of its most crucial COVID powers, but could see travel restrictions re-implemented if deemed necessary. Now, any new measures will be required to pass through legislation as the country looks to long-term management of the virus. We have more in this package.
For more than 2 years, New Zealand has been governed by some of the world's toughest COVID-19 restrictions. Now, the government is winding down on some of its COVID-19 powers, saying they are no longer justified. Vaccine mandates, managed isolations and lockdowns will be scrapped, leaving only a handful of public health measures. Also ending on Thursday is a requirement for travellers flying to New Zealand by air having to complete the online New Zealand Traveller Declaration. However, the 7-day case isolation period and mask-wearing requirement for visitors in some healthcare settings will remain for the time being as cases and hospitalizations tick up.
Look, we haven't had a lockdown for a wee while yet, but I think New Zealanders will be feeling good and reassured that there aren't any in the foreseeable future.
The government will also revoke the epidemic notice, which represented a move away from emergency arrangement to long-term management of the virus. The advent of other tools, such as widening availability of antivirus, was instrumental in this decision. That is according to the Acting Minister for COVID-19 Response, Chris Hipkins. The COVID-19 Public Health Response Act was introduced in 2020 to provide an extraordinary set of legislative powers that enable the government to respond to the pandemic. It also provided the primary legal framework for implementing the mandatory public health measures and was due to be repealed in May 2023 unless done sooner. Prime Minister Jacinda Ardern believes every New Zealander is pleased over the new phase on government's management of the COVID-19 pandemic.
Every New Zealander, I think, is pleased to see us coming into that new phase, as we have been for some time, of COVID management.
The approach now sees a shift from emergency-level measures to long-term management of the virus and potential future pandemics.
The harshness was warranted because we had that wave coming, we could see it coming, and it would have been negligent to go, well, okay, whatever, because we didn't get the death rates of the UK, the US, and Spain and France and places like that. Now that COVID is a new reality, it's like we're going to have to learn to live with it.
The experts have to have their say, but we have been told over and over again that masks do work, which is why I'm wearing one.
Yeah, I just think we can either be sensible and live with the current environment and just take sensible precautions, or alternatively, if the government was to feel that it was necessary because it was going to be a risk to life, then restrictions will no doubt be the order of the day.
In the past 7 days, more than 14,000 cases of COVID-19 have been reported in New Zealand. Numbers are rising, but health authorities are confident in their level of preparedness.
Effectively, we're leaving the door open to having those things for next winter when we could see a significant resurgence in case numbers, but we're taking most of the things that we've done previously off the table.
The next review of COVID-19 measures will be completed at the end of November.